Hi, I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council. Today I'm going to be talking to you about aspects of cardiovascular disease. This is important for us across the city as over 300 people every year die before the age of 75 because of cardiovascular disease. That's over 300 lives that could be saved. And they could be saved by small changes that we make every day in our lives that have a real impact on our heart and on our heart health. So cardiovascular disease is linked to a whole range of risk factors, and unfortunately this is the bit where it all feels a bit motherhood and apple pie. The things that we know we should do better in our lives, like giving up smoking, reducing the amount of alcohol we drink, managing our weight, and eating a healthy diet. There are some things that you can't change. The reality is, as we get older, our heart and our blood system does get a bit more worn out, and that does have an impact on the risk of cardiovascular disease. If you have a strong family history of high blood pressure or stroke or heart attacks, it's very likely that you will have increased risk as well. So it is important to have that chat with mum and dad or with your grandparents and know your family history a bit more. And there are things in the world around us that impact on cardiovascular disease as well. From air pollution to the environment that creates a situation in which we don't take as much activity as we should every day, those do play a part. But there's a lot that we as individuals can do that reduce our risk. So it's important that you educate yourself, that you understand what your risk might be from your family history and also what your risk is in terms of what happens to you every day. The Healthy Hearts website has got lots and lots of information. So I'm going to talk about some things in the video, but I'll skim over them quite quickly. So please read on the website and find out a bit more, because there's lots of really useful hints and tips. There are also some really good tools where you can put in your own numbers and work out what does it mean to you. So often when we talk about cardiovascular disease, people go, well, it's something to do with my heart. And one of the ways I try and describe it to patients is talking about it a bit like the train system. So if you think about our heart being a bit like New Street Station, all the trains come in and out, and it's the kind of centre of the system. And the trains are carrying oxygen and nutrients around our body. We also know, of course, every winter leaves get on the track and the trains get clogged up and they don't run quite as well. And the same is true in terms of your circulatory system, your cardiovascular system. Things like cholesterol clog up those arteries, they clog up the veins, and then the trains, the blood cells carrying all those vital nutrients to your organs can't get through. And the things that we do every day are the things that interrupt those train tracks. If we eat a healthy diet, and that's not about banning cake or chocolate, but it is about getting balance, making sure you've got enough fibre, that you're not eating too much salt, and that you're avoiding really high processed foods which often have lots of hidden salt and sugar. Those things can help keep the tracks clear and the trains running on time. And in your day-to-day life, you want the trains to run on time. Well, it's the same for your heart and your body. You need your circulatory system to function as best as it can, because it's delivering all of those important things that keep our organs, like our brain and our lungs and our muscles and bones, working to the best they can be. So the Healthy Hearts website's got a lot of information about how you can make everyday changes to your lifestyle that can improve your health and reduce your risk of developing cardiovascular disease. Often it's easier to make small steps. Most of us at some point in our lives have done a January diet and it's probably lasted 3 to 4 weeks, if that. New Year's intentions are great, but unfortunately most of us don't actually follow through on them. So the website's got some helpful information about how you can make small changes that improve your life, your health and well-being, and integrate them into every day. We know, for example, that taking a short walk every day, just down to the end of the street and back, of about 10, 15, 20 minutes every day, will reduce your risk of having a stroke or a heart attack by over 20%. Small change, big impact. Reducing the amount of salt you eat by switching to products which are lower in salt, such as low salt crisps, and looking at some of those microwave meals and what the salt content is, making slightly different choices. Doesn't mean you don't have a delicious meal, but it does mean you do it in a way which is protecting your heart and protecting your future. One of the biggest things you can do to protect your heart is to give up smoking. Unfortunately, smoking is an addiction and we know it's really hard to quit. Most people take about 11 attempts to quit for good. So if you've tried in the past and it hasn't worked, Don't give up, keep trying. Every year there are new bits of kit, new patches, new gums, new vapes that make a difference. Even if you make the shift from smoking cigarettes to vaping, that will reduce your cardiovascular disease risk. Vaping isn't perfect, and the nicotine in vaping still has an impact on your heart, but it's a lot better than smoking a cigarette. So making those changes can really improve your heart health, and that will improve your chance of living a long and happy life. So I want to talk a little bit now about what to look out for if your heart and your circulatory system perhaps aren't working quite as well as they should. The two big things that we're most worried about are people having strokes and heart attacks. A stroke is when there is a clot, a cloggage in the train line in the blood vessels that are supplying oxygen to your brain. So the train just can't get to where it needs to go, and it can't drop off those vital nutrients. So a bit of your brain is starved of oxygen, starved of nutrients, and therefore can't do what it needs to do. The signs of a stroke we remember through an acronym, the letters of FAST. So whether people face drops often, so they have a side of their face or a bit of their face drops, they can't raise their arm, their speech is slurred, and it's comes on very quickly, so it's timely. Recognizing those symptoms can be a really important thing to do, because if any of those things happen, if someone that you know or love, or it happens to you, and suddenly your face drops, this is really noticeable. People's faces do drop. It is like side of the face slide, like an avalanche down. Or they say, I can't lift my arm. And it's not, oh, it's achy, it's painful. I just actually cannot lift it at all. I can't feel it, can't move it. Or they're speaking to you and their speech slurs as if they were drunk, but you know they haven't had any alcohol. They can't get words out. Then you need to act fast. You need to ring 999 and you need to get them to hospital as quickly as possible. Because we know that in a stroke, if we can get someone in that first hour when that stroke's happened, we can use some of the medicines we have to dissolve the clot, to dissolve the blockage on the line, or to go in and do special procedures which can bring the nutrients back to the brain, and the brain has a chance of recovery. And I have to say, since I qualified as a doctor back in 1999 to where we are now, the number of people who survived from a stroke has massively improved. Many of us will have seen celebrities like Andrew Marr who've had a stroke and talk about it openly, and actually how well he's recovered and returned to a normal life. Unfortunately, 20, 30 years ago, that wasn't the case. So keep in mind the FAST signs and keep looking out for them, because if you do have cardiovascular disease, being aware of that is really important. The other thing that we're very conscious about is having a heart attack. Now, when we're at medical school, we're taught that a heart attack, the pain is not a sharp stabbing pain, it's a crushing pain. It feels like someone's sitting on your chest and pushing your chest down, but there's a pain that radiates normally down your left arm. Now again, medicine's changed slightly since I went to medical school, and now we know, for example, in women, those signs are not quite the same. That women often still feel that crushing, tight pain on the chest that's really like someone sitting on your chest and bearing down on it. But they may not get the same radiation into the arm, and they may feel pain in their breasts rather than in their shoulders or their back. And so there are different ways of presenting, and if you look on the Healthy Hearts website, you can find out a bit more about this. But if you are someone who's living with cardiovascular disease, then it's important you know these symptoms. If you have someone in your family with cardiovascular disease, it's important you know these symptoms. Because when these serious things happen, the important thing is to get help. We know that if we can get you help quickly, if we can get you to hospital and get you treated fast, then you have a much better chance of survival. There are lots of other signs of cardiovascular disease which are in the much earlier stages. People get pains in their legs, they get chest pain, get a feeling of being lightheaded as their pulse is racing, and there are irregular heartbeats. And there's all sorts of things that I haven't got time today to go into, but on the website you can find a lot more information about both what a healthy heart feels like and what it feels like when some of your health in your heart is perhaps deteriorating and not doing quite so well. So do have a look at the website and find out a little bit more. Finally, I want to just share, I suppose, some top tips about looking after your heart and being aware of this. Over 300 people across Birmingham die every year before the age of 75 from cardiovascular disease. When I look at the numbers across the city, both for Birmingham and Solihull, too many people are going into hospital with a heart attack or a stroke. Yet we know if we can find out that your heart's not working as well and you've got problems with your circulatory system, there are lots of things that we can do as doctors and nurses and pharmacists to help you. But we also know there are lots of things that you can do as well that will make a difference to how your heart develops and whether that disease gets worse or whether it improves and you continue to lead a happy, healthy life. Across the city, you're able to pop into pharmacies and check your blood pressure regularly, and that's a really important thing to do, particularly if you're getting older. You know, the NHS talks about knowing your numbers, and actually knowing what your blood pressure is quite a useful thing to do. Certainly if you're over 40, I would say knowing your numbers once a year at least is a sensible thing to do. And as you get later in life, knowing it a little bit more frequently. Those of you that go to healthcare professionals regularly will know that we take any chance to slap a cuff on you and check your blood pressure. And that's because it's a really good marker of whether your heart and your circulatory system is working as well as it should. If you're over 45, you're eligible for the NHS Health Check programme, and as part of that programme they'll check your cholesterol as well as your blood pressure, and they'll also check your pulse to look for irregular heartbeats. You know, some of these things you're able to access if you're younger and you've got a family history as well. And if you are concerned about heart disease, please pop in and talk to your pharmacist. You know, we often underestimate what pharmacists can do, and it's important to remember they go to university for a long time to train to be pharmacists. They are really qualified healthcare professionals. And across the city, we've been doing a lot of work to support pharmacists to help you around your heart health. So if you've got some concerns and they're just general, I would pop in and see your pharmacist as your first point of call. Use some of the kit that's available. Do your blood test, check your pulse. Understand your numbers is a really good way of getting on top of your heart health. And whatever your health is at the moment, it's never too late to make a change. If you're struggling with your weight, getting physically active can make a difference. If you're struggling with smoking, dealing with your diet can make a difference. Often when we're struggling with our health and our lifestyle, trying to do all these things at once can be a bit overwhelming. So start with one thing, a small change every day, like taking a short walk, or reducing the amount you smoke, or switching to vaping, or reducing the salt in your diet. Small changes have a big impact. And when it comes to your heart, you want to have a big impact.